Hello again, everyone. Here we are on Dr. Jeff Says. My name is not Dr. Jeff, it's Don DeCesare, and I'm here with the buttons and the knobs, but I've also got with me my dear friend, Dr. Jeff Rebuffo, who is here Mondays and Thursdays at 11. Good day, Doctor. How are you, sir?
Don, I'm great. I had a wonderful, wonderful weekend.
You did?
Yes. My granddaughter, who's a senior at the Hart School of Music, had her senior recital. And,
wow. So you're a proud grandpa.
Absolutely. Absolutely. It was terrific.
I'll bet it was. Well, congratulations to her, and we'll look forward to updates from you on her career.
Oh, I will.
Yeah.
I'll be sure and let you know.
Okay, good.
Don't worry about that.
Okay, good. Well, I love to hear about bright young people, and the one thing I know for sure, because I had have a daughter who was a bright young performer herself back in the day, and the country has a lot of bright young performers. So this is great. Yeah.
Good. Well, thank you.
So give us an update from time to time.
I will.
As you know, and when she's ready for her Broadway debut, I expect to get some front row tickets. Okay.
I'll be sure you get them. Believe me.
All right. Well, you brought a terrific guest with you today, so we will save some of this personal stuff for another time.
Okay.
Why don't you introduce your colleague here?
Sure. Very happy today to have a guest with us, a physician that I've worked with for many years, Dr. Richard Greiner. And Richard was and is still an ER physician at Middlesex Hospital. And I've worked with him over the years, a very, very fine physician and easy to communicate with and good common sense. And that common sense that he has sort of expanded his horizon. So, Richard, why don't you tell us a little bit about yourself first? Where are you from and where'd you go to school?
Thanks a lot, Jeff, for having me, first of all. So I'm from Pennsylvania. I went to college at the Naval Academy and went to medical school in Penn State's College of Medicine is in Hershey, Pennsylvania, so it was actually close to home. It was nice to go there, and I went to residency at University of Pittsburgh. And then after that, came to this area about 7 or 8 years ago.
All right, I got to interrupt the doctor here because I'm a graduate of the University of Pittsburgh. Just so we know.
Oh.
Just so we know. And that's a fantastic medical complex they have there. So I can attest to that personally. Continue.
Thanks.
Good.
I had a great experience there. I was impressed too. I grew up in Pennsylvania and really didn't know the west side of the state much before I got to Pitt, and I was impressed at everything Pittsburgh itself had to offer. So we were really happy to be there when we were there.
Good. So you came here 7 or 8 years ago, you said, and you got a job in the emergency room. And we all know about emergency rooms. They're busy. They're very dynamic. They're very highly stressful. They're overloaded with long waiting times. And so you had an idea that there must be a better way. And we were talking a little bit outside, and I thought that, why did he come up with this idea? You know, somebody told me a long time ago that Jonathan Swift said that, the future is seeing the art of the invisible, and I would put Richard there. So why don't you tell us about what's on the horizon for emergency room medicine, or what your idea is?
Well, I think what you're talking about is most recently I got involved in urgent care, and it wasn't my idea at all. It's been around, and they've kind of come and gone and got more and less and more again popular over the years. But I've been looking at the emergency room patients, obviously, for a while, and after the last few years, I've been thinking, this system could do better. And I look at many of them as system failures if they come in, because they don't have a doctor or they weren't taking their medicine or couldn't get in to see their doctor. So I feel like, there's ways that we could help these patients without them all coming into the emergency room. And urgent cares have become more popular, and I had an opportunity to get involved in one. So I thought it's just one of many gap fillers to help make our kind of medical system better and help our patients before they get to the point of an emergency, when they may have just an urgent problem that we can help them with to stay out of the hospital and, save them time and money.
I think that's a terrific idea, and we spoke a little bit outside, and I asked Richard why you and why not some of the other physicians that you know. I mean, you're the one that kind of took the bull by the horns, or the bit in your mouth, whatever the expression is, and sort of recognized a good idea, and you got yourself very involved in it. What's the difference between you and the other physicians that you've worked with?
Well, that's a tough one. I don't want to speak for too many of them, but I think in general, it's a little bit outside of our comfort zone. I mean, doctors like to treat patients, and that's what we do well, and that's what we like to do. And administration is something that's a little less natural for us. And so getting involved in things outside of treating patients is a little bigger of a challenge. And so, but I'm definitely someone who doesn't mind a challenge. So I think I looked at it that way too, as this may be my next challenge to try to help make a difference outside of just the patients that I can reach every day. So I think it was just an opportunity. I took it. I don't know that I'm, that other people couldn't do it. It just, it seemed more timely for me, at least.
So when you're working in the emergency room and you're seeing these patients that have these problems about access, I guess is a good way to see it, and you felt that there was a better way to do it. So you're working with some other people, I understand, in an urgent care center. And tell us about that place.
Well, this urgent care is in Cromwell. It's across from the Cromwell Diner, just outside of Middletown. And we're working with a great team. I think that's what I'm most happy with, is the team that we have. And many of them are from the emergency department or from that background. And so I'm really lucky to have that group of people. And the people who started it are similar to the ones that you're used to working with and starting surgery centers. So, and I was really happy to meet them and learn a lot from them. And I guess I would say that, our center and urgent care in general is a little bit like, an outpatient surgery center, in that it is more convenient, it's more affordable. The surgeons are typically happier when they work in a surgery center.
Amen.
So I would say that the overall caregivers are, more relaxed and more happy, and we deliver more a patient-centered experience. And it's overall, more affordable to the whole system.
Good. Are you saying that the situation is more satisfying for you as a physician because you can deal with the patients in an easier way? Is that a good way of describing your experience?
It is. I mean, I definitely have more time to spend with them, and I'm more flexible in what we do. I do still like seeing really sick patients, so I'm glad that I'm still working in the emergency department to kind of keep that part of me alive. So I wouldn't want to just see walk-in patients exclusively at this point in my career, because I feel like I want to keep my skills alive. But I really do like spending a lot of time with patients, and really not having a lot of preconceived notions as to what they think they need. I feel like they're more open-minded when they come into the urgent care.
Now, we talked about your involvement, but what would you consider the driving force behind the creation of urgent care centers? What was the need that these centers are trying to fill?
Yeah, that's definitely it. It's based on a need. So the need is that, and it's probably, that's why it's ebbed and flowed over time, is that now patients are more involved in their own health care expenses. So they might have a higher deductible insurance plan, and they're paying more out of pocket, and they realize that if they're going to spend that kind of money, they want to be more involved in their own decisions, and maybe they want to spend less money. So we're just kind of a gap filler, and there's definitely a need for filling that gap in between the primary doctor and the emergency room, and that we're more affordable. It's really a gap of convenience too. I mean, a lot of patients would like to see their primary doctors, and many patients in this area do have primary doctors. But it's unreasonable to expect that every primary doctor is going to have office hours available all the time for acute visits.
Yeah.
So, patients just don't want to wait a few days to see their doctor, and so I think we fill that gap. We see them, and they may still get to see their doctor in a few days after we've treated them, and then they can see, well, did that treatment, work for them? And so I think it's a gap that we're filling for the.
Now, do you folks out there, do you make it a point to communicate with the primary care people if you need to, or how do you do that?
We do a little bit of that. I'd say we do that similar to the emergency room so far. We communicate better with the patients, I think, in general, but as far as with the primary doctors, I find that the care is not necessarily as complicated, so it doesn't require as much coordination. It's not as much high risk. So I would say I'm not really we're not as a group over communicating by phone with primary doctors. We do communicate with them, and we make sure that the patient gets follow-up visits, and we communicate with specialists to arrange visits. But mostly we're communicating with the electronic medical record, and we have all our records faxed to the primary doctors. So I think we're getting good communication that way. But again, just getting started. So if if we're finding that we're not communicating well enough, we can always adapt and do that better.
Now, how long has your facility been open?
So our facility's been open since October. I've been involved since December and then full-time there since February. So we're new, and I'm new to the job.
Yeah, but your emergency room experience, I'm sure, helps make you good at what you're doing out there.
Oh, sure. I mean, seeing patients, that's natural, and that's not a problem at all. I'm happy to see anything that walks in the door. That's just as far as, the administrative part is something that's new to me, and, working to grow the business and, working on new quality systems and protocols for our center is good for me.
Let me interrupt you here, doctors, just for a moment. It's time for us to take a little bit of a break, so you can both relax a little bit. This is, of course, Dr. Jeff Says, and our Dr. Jeff is here with a special guest, and we're talking about emergency medicine, and we're defining the differences between emergency and urgent. And we'll continue that conversation here in just a moment, so please stay with us on Dr. Jeff Says.
Let other people order for you?
He'll have the small lyonnaise.
No, I won't. So why let others make decisions about your older years? Do you want your kids or perfect strangers choosing where you'll live or how your money gets spent?
No.
Go to longtermcare.gov and find your own path forward. It takes you step by step through everything you need to consider about aging and all your options. Longtermcare.gov. Plan now to stay in charge or pay later.
How about a mohawk?
Very funny.
How do we get a diagnosis?
What are the stages of the disease?
When someone in your life has Alzheimer's, not a day goes by that you don't have questions.
Do we need full-time care?
Are there any new treatments?
So many questions. Where do you start?
How will I pay for this?
Where can I get extra help?
Alzheimers.gov, a reliable resource for information about Alzheimer's and related dementias.
What happens next?
Where can I find answers?
The answers start here.
And here we are back on Dr. Jeff Says. My name's Don DeCesare. I've got the buttons and the dials, but I've got two doctors here in the studio today, so I am very honored. With me, of course, is the host of the program, Dr. Jeff Rebuffo himself, and he has a special guest, and they're talking about emergency medicine and urgent care medicine. And by the way, on the phone is the Pitt Alumni Association wanting to know how many bricks you're buying in the walk. But we'll talk about that when you finish the conversation here. Dr. Jeff, take it away. Oh, I should remind everybody, 11 o'clock Mondays and Thursdays. And if you're not able to be with us, well, shame on you. But we fixed that problem for you very easily by making this available online, on demand, at WLISWMRD.net. So tell your friends and neighbors and spouses about it, and give it a listen when you can. Doctor.
Good. We're talking this morning with Dr. Richard Greiner, who is an emergency room physician currently at Middlesex Hospital, but he's also, in talking to him, has noted that there might be a better way to treat people who maybe are not actually emergent, but basically urgent. People that don't have family physicians or don't have the right medicine or can't get appointments or all of those things. So I guess one of the questions we want to ask is, Rich, what's the difference between emergency and urgent? Or is that something that's even definable?
Well, I think it has to be defined based on the patient's perspective, and we talk about that a lot in the emergency room, like what constitutes an emergency. And so it really has to do with what the patient thinks. If they think they're having a true emergency, then they probably should go to the emergency room. But I think many patients realize that they're not having a true emergency, but in the past especially, there may have been less options for them available, and so they would come to the emergency room because they couldn't get a primary doctor or didn't have one or couldn't get in to see one or didn't have good transportation or were worried about how they're going to pay for it. But I think our patients so far have been really good at figuring out what is urgent to them and what's not an emergency, because they really self-triage pretty well. We really haven't seen many patients who should have instead been in the emergency room. And so I think that it's really in the patient's perspective. Many of them will come in to see us with things like abdominal pain or chest pain or shortness of breath. And on the surface, it would sound like, well, those are probably emergencies. But when you hear more about it and see the patient, you realize that, no, they're really in the right place because they're not having life-threatening causes of those illnesses. And, in fact, there are frequently things that we can treat well for them and, get them the right follow-up.
Well, it's interesting because I remember when emergency rooms were... in fact, I started my career right after my internship. I was the first full-time ER guy at St. Francis Hospital in Poughkeepsie, New York, which is now, a pretty big tertiary hospital. And then I came to Middletown, and as I noticed that more and more patients were going to the emergency room for a few reasons, one of which is insurance covered the emergency room and it didn't cover the office visit, which it does now. And I remember a few years ago when people go to the ER and Anthem Blue Cross had this campaign to educate patients that emergency rooms are for emergencies. And I think I was talking to Dr. Bernstein, who works at the ER, saying, well, you don't know if it's an emergency or not until you actually talk to them and examine them. So that's kind of not a logical way of approaching this. So it's interesting to hear you say that the patients are now educating themselves as to what's the right way to go about whatever the problem is. That's a fascinating change and dynamic. It's got to be gratifying for you, too.
Well, for sure. I think the patients have an idea of what's going on and what level of care that they need. And, they're not going to be right every time, but especially if they think of urgent care as one option, if they're not in the right place, we're going to be quick to get them to the right place.
Now, when people come to see you, do they need to call ahead or can they just walk in, or how does that work?
No, not at all. Most people just walk in. A few do call ahead to see if there's any wait. We do have an appointment system too, but not many people use that yet because there's really very little wait. Most people get seen within 10 minutes and get out the door within 40 minutes for the most part.
Good. Now, as far as payment goes, do the insurance companies cover these visits, or can you talk a little bit about that?
Yeah, they sure do. So we take most insurance, and insurance does cover these visits, and it's paid out by the insurance at much less than the emergency room cost, so it saves the overall system money too. And we take patients without insurance, so there's very affordable self-pay options as well.
That's good. Do you, are there other facilities in the area that think you're a competitor, or is everybody in the same game trying to help people, or is that the dark side of medicine?
Yeah, it's hard to tell. I haven't really talked to those people who I guess might be competitors. You would say it's easy to see that there's a lot of urgent cares, going up all over the place, and Connecticut's no different in that respect. So far, they're not on every corner, so we don't really see our competitors eye to eye. So I guess we don't really think of them that way. Right now, we really serve a local market, and it's we don't really think about what competition might be out there so much as how can we better serve the people who we're convenient to.
Is it 7 days a week?
It sure is, yeah.
24 hours?
No, not 24 hours. We're open 12 hours, 8 to 8 during the week, and 9 to 6 on the weekend.
So if I come down with a really bad cold on Friday night,
before 8, we're happy to see you. After 8, give me a call.
All right. Well, good point. Good point. But so I can come in, let's say Saturday morning after sniffling all night, and you or one of your colleagues will see me. Is that
Definitely.
How, is that
certainly.
how it works?
Yeah.
Because obviously most primary care doctors don't have Saturday hours anymore. Some do, but not most of them. And a cold, I picked something particularly obvious, wouldn't qualify really as an emergency. Even I know that. Mm-hmm. But you're uncomfortable. You're distressed.
Yeah, I think we're very appropriate for that option. And yeah, the emergency room's probably not.
Right. Yeah. For all the obvious reasons, including it's just not fair to bottle up the emergency room with my cold.
Definitely.
Right.
Yeah, but how I think your point is well taken. Is who makes the determination about who goes where? And I think that if you work with the patients and if they think it's an emergency or it's not an emergency, then I think that's a great attitude to have. And it certainly kind of takes some of the stress off the patients, because going back to the time when a lot of the insurance companies didn't appreciate the fact that the patients were using the ER. The patients would go to the ER for, maybe they thought they had pneumonia and they just had a bad chest cold, and then the hospital would bill them and the insurance company wouldn't cover it, and there's all those kinds of stress. So this is a very, very positive change, and it's kind of interesting to see how this has evolved, because, we start off with the physician's office visits, which were not covered, and the hospitals were. I remember when I was, during my internship years and years ago, that patients would be admitted to the hospital for their x-ray preps. If they were going to have an IVP or an upper GI, there were certain GI preparations, and the patients would be admitted for that, and insurance companies paid for it. And you think back now, that's kind of a little silly, but so it's kind of like, it's almost like I think of this whole business as like going with the cash flow. Wherever the insurance companies say they'll pay, that's where the patients go. I mean, and that's not an abnormal way of viewing things, and as long as it's appropriate, I think it's a good thing. But what do you see in the future for urgent care? Do you see them as expanding the care, maybe upping it, getting a little more involved in semi-emergent care, or what do you think is going to happen?
I think so. I think urgent cares will evolve and spread, and kind of fill the need, and once the need is filled, then they'll contract or find a stable state. But I think it is about how the health system is changing in general, and health systems are trying to become more affordable, and whether that's insurance companies trying to save money and patients trying to save money, the gap fillers and urgent cares will fill that gap as much as possible. But then it'll be really again driven by the patients and what they want for more convenient options, and there's only a certain number of patients with illnesses out there, so they'll only expand to a certain extent. But I think that there's a lot of opportunity out there for urgent cares to do more than just urgent illness. I mean, it's really just one more available option to fill other gaps too that might be convenient to save the hospital and the health system money, so we can do health screenings and physicals and pre-op physicals and things that normally you would have to plan ahead and call your doctor and make an appointment. Instead, you could just at the last minute drop in and get your pre-camp or pre-sports physical done all at once.
Well, I would think that would be a big plus for patients, because most families are now two-income families. They don't have a whole lot of time to deal with this. A lot of time they make appointments, and then the other child may get sick, the other child in the family, so they have to reschedule the appointment. It's another couple of weeks. So this would be a real convenience for just the routine medical care that people need. And I think it's great.
We're definitely the convenient choice. I think that's our bread and butter, is convenience.
So how many urgent care centers are in the state? Do you have any idea?
In this state, I probably should. I'm sorry. I think in the country there's around 7,000 to 10,000, and they're growing frequently. Yeah. So not sure how many are in the state. I should probably know that. No,
that's fine. Do you are you the only one in the area? That's an area, I'll say Middlesex County.
No, Middlesex. Well, we're not. I guess we are right on the edge, and we are in Middlesex County. There's at least one or two other. There's actually a few more down by the shoreline, especially in Middlesex County. So we're the only ones in our small area, serving the local community of maybe 5 miles away. But there's a lot of other ones that are further away. But people won't drive all that far for an urgent care, so it's really more of a local community that we're serving.
Interesting. I hadn't thought of it that way. So we're talking to Dr. Richard Greiner, who is involved in these urgent care centers. And so you mentioned that you're getting more involved with, or going to get more involved with kind of the routine day-to-day school physicals and employment physicals and things like that. How do you think that will fit with the primary care people? It would seem that it would free them up to do the more intense stuff that they do, like managing heart disease, diabetes, and so on. Do you think they see that way?
I would think so. I think most doctors who are established have already a lot of patients and don't have a lot of time to do those things that are, not necessarily require a long-term relationship with a patient. So, and that's really the problem in our whole country is there's not enough primary care doctors. So if we can free up some of that primary care doctor's time to do those simple things for them, that's just a matter of doing a pre-employment screening or sports physical. I think that most primary doctors would be happy to give that up. And not have to see those patients unless they're not busy enough. But most of what I hear is they're plenty busy. That's why we're seeing patients for those reasons.
Well, I have to say I admire your vision because this has always been, this problem about the urgent care has always been in my background. When I first came to Middletown, there weren't many primary care people, so I was doing primary care as a urologist just because there was nobody else. So it's been a pleasure to have you here, very educational for me, and it's nice to see you again after all these years. We actually ran into each other at the chamber breakfast about a month ago.
Great.
So it was terrific, Don.
Well, we should tell folks how they can, where the urgent care center is and how they can get more information about it.
Oh, thanks a lot. We are in Cromwell, right across from the Cromwell Diner at 136 Berlin Road. You can find us online at cturgentcarecenters.com. And just stop by. You don't need an appointment, don't need to call.
Great. Well, thank you so much, Doctor, for coming in. And, of course, Dr. Jeff, great to see you as always.
Nice to see you.
Congratulations again on your granddaughter's recital.
Well, thank you.
And we'll remind everybody listening to us that we're here on Mondays and Thursdays at 11 a.m. And, of course, the program is also available on demand at WLISWMRD.net. And now I will say to you nice folks out there listening, stay well, will you please? We'll see you again next time on Dr. Jeff Says. Bye-bye now.